This is Dr. Wade Burbank, and welcome to my lecture on spinal anatomy. First, we're going to talk about the anatomy of the lower back, or the lumbar area. And if you take a look at the model here, it's a 3D model of the spine, and we're going to rotate it. So you can take a look at the front. There's the front, the side, and the back of the bones, the lumbar vertebra, which are... Here you can see L5, 4, 3, and 2 of the lower back. And this lower bone here, this kind of curved bone, is called the sacrum. And at the very tip of that is called the coccyx. The sacrum is a very strong and large bone. And it's a very important part of lower back health, as well as the vertebrae and the discs. If we go to the next slide, you can see how the sacrum, or the tailbone, interacts or connects to the pelvis bones on either side. Again, there's the back portion, side, and then the front. Also, it shows here the anatomy. If we stop it for a second, it shows the anatomy of the hip, where the ball and socket joint of the hip comes together with the lower part of the pelvis, and where the pelvis connects with the tailbone. That joint right in there is called the sacroiliac joint. So we'll see it again. We can rotate it some more to get a better look at it. If we go to the next slide, you can see the ligaments now, and the discs have been introduced into the picture. You can see how there's ligaments between the tailbone, the sacrum right here, and the lower part of the pelvis. There's also lots of ligaments that connect the tailbone to the pelvis across the sacroiliac joint. There are also in between the bones. Just stop it for a second here. Here's bones of the lower back of the lumbar vertebra, and in between is their disc materials. And we have the anterior longitudinal ligament right here too, that connects the vertebrae from the front. So again, this is a view from the front of your body, and here's a view of the back. It's quite lots of ligaments involved in the lower back. Let's go to the next slide. More ligaments, and we're starting to get introduction of some of the smaller muscles. These little red lines here by the vertebrae, on the side of the vertebra, are muscles that are involved mostly with actually sensing the position and the mobility. They're kind of motion sensors of the lower back, so that your brain can detect what position your vertebrae are in. There's also an important muscle over here too on the right side. This muscle is called the piriformis muscle. It goes from the hip bone and it goes underneath some ligaments and attaches actually to the tailbone. And that muscle can actually pinch the sciatic nerve and be a cause of a tremendous sciatic pain. Sciatic pain is pain that shoots down your leg. Here's the front view of it. Here's the piriformis muscle right there. And again, the sciatic nerve comes out of the spine and sometimes goes through the muscle or right beside it. So spasm of its muscle in your buttock area can actually cause tremendous pain in the back. Take a look again around. Here's some more muscles involved. Muscles of the back, muscles of the pelvis. This is called the iliacus muscle, and it will conform and come together with the psoas muscle right here. Psoas, iliacus muscles actually help to flex the hip. So often back problems and hip flexor problems can go together. Look at that again. Just adding more layers. This is an incredible program where you can see different layers of the muscles that are involved in the back, and even more and more muscles. Here we see that there's a now the blood vessels, the major blood vessels. I'm going to stop it right here. Here we have the aorta, and it breaks off into the common iliac arteries, and then they also then break off further down into the external iliac arteries and the internal iliac arteries. There's also a small artery there, branches that actually provides blood to the coccyx area and the sacral area. Here's how the nerves are involved with the lower back and pelvis. As you can see, it's very complicated. And again, this is a simple rendition. These are only showing the major arteries, muscles, and nerves. And let's take a look at rotate it. Now they have the veins involved, the ones that are in blue. How the veins come through. And we're going to stop it again here. There's the big sciatic nerve right there. See how the sciatic nerve comes out? And it goes right past this piriformis muscle. And when you have piriformis muscle spasm or tension, it can actually pinch that sciatic nerve. So some people think they're having disc problems because disc herniations can cause sciatica down the leg or pain down the leg. But it could be also not the disc that's causing the pinching, but the piriformis. Again, this is called piriformis syndrome, and the piriformis muscle here pinches the sciatic nerve there. And we have tremendous problems. It can be very debilitating. This just shows that where the nerves in the back go to the skin. Here's some more pictures, just how the bones of the spine and of the pelvis and of the tailbone interact with the blood vessels, the arteries in the back of pelvis. Here is how the veins interact with the pelvis in the back. And here are the nerves that are in the lower part of the spine. Here's the front, there's the back. You can see how involved the spinal cord coming down, and then it branches off and exits the vertebra, exits the spinal canal through these little holes between the vertebrae. There's also some of the spinal cord that goes actually into the tailbone. You can see that the artist has cut away part of the tailbone and the back portions of the vertebra so that we can see the spinal cord and the spinal nerves better. Take a look at that again. Here they're all attracted together, veins, arteries, and nerves together in the lower back and pelvis. It's quite an amazing thing, all these things coming together, working together. Thanks for watching. It's been nice talking to you. It's Dr. Burbank, Vancouver, Washington, chiropractor. Thank you very much.